A recent World Health Organization report shows that the COVID-19 pandemic has fueled the largest decline in childhood vaccines. It threatens to undo efforts made in preventing and controlling vaccine-preventable diseases globally. For more on this, let's speak now to Dr. Edina Amponsah-Dacosta, postdoctoral research fellow at the Department of Health Sciences at the University of Cape Town. Doctor, thank you very much for your time. Let's perhaps begin the conversation with just how bad the situation is, and perhaps starting closer to home, just over the Limpopo River. Zimbabwe, we know that at some point they have been dealing with the measles outbreak. What categories of vaccines are we talking here where Africa has fallen behind?
Well, thank you very much for having me, and thank you for that question. So in order for us to really understand how our immunization programs have changed and why we're starting to see these outbreaks, it's important to just move back in time and look at where we were before the start of the pandemic. So in the region and just across the border from South Africa, we were starting to have, advancements in our immunization programs. We're doing very well. However, with the pandemic, we started to see a decline in immunization rates, and we're starting to see a decline in diphtheria, tetanus, pertussis immunization rates, as well as our measles vaccines. And that is the reason why we're starting to see the situation that we're in right now.
So let's talk then about where things are. I know, for example, the South African Health Minister, Dr. Joe Phaahla, at some point he was rallying South Africans to immunize against TB because that was one of the vaccination efforts that was falling or had fallen behind as a result of the COVID-19 pandemic. I know that the rolling out of HIV AIDS treatment, that also it also was impacted at some point. So where do we start at a time like this?
It's a very important point you raise. So as you've rightly mentioned, our health services took a hit. And our immunization services particularly took a hit. The COVID-19 pandemic didn't do us any favors. It disrupted delivery of these essential services. And so in looking at how we begin to rebuild, it's important that we increase and maintain high immunization coverage rates. And we can begin to do that by intensifying investments in our immunization programs to reprioritize immunization services in our health agenda. It's also important to generate further demand for immunization services, and we can build this back by increasing public trust in vaccines and immunization services as a way to secure the health and well-being of our children within our region and within our country context.
Yeah, and Doctor, it goes without saying that when you have to embark on, it's almost a reinvigorated campaign, you have to do that via messaging, because messaging becomes very, very important. I mean, you have diseases that can be avoided, but if a person contracts polio, for example, that they could have been vaccinated against, that becomes a lifetime effect on that person's ability to do things. How important, and perhaps where do we start as far as communicating this to citizens, that immunization is important?
So with platforms like this, being able to use media platforms to bridge the gap between the scientific space and the general public, so to speak, it's important, as you've mentioned, that we improve our communication strategies. before the pandemic, we most probably weren't doing so well in how we communicate with the general public and how we deliver critical health information to them. But with the pandemic, what the pandemic did is it became a catalyst for dialogue, for having continuous communication between the scientific space and the general public, and ensuring that the general public has the right information to take ownership of their health and make critical decisions. And so we need to develop our communication strategies. We need to improve dialogue, make sure that the public is able to communicate with us, to share their concerns and fears when it comes to vaccines and immunization services. And for us on the immunization or the scientific space to take careful consideration of these concerns in improving our immunization services and make sure that they are responsive to the expressed needs and concerns of the general public.
So let's chart the way forward then as we wrap up the conversation. Useful lessons that we could say we have learned from the COVID pandemic, because this is perhaps one of the many pandemics to come. How do pandemics like this not destabilize the immunization processes that would have long been in place anyway? In other words, how do we not stop prioritizing those immunization programs that were already in place?
Yeah, that's a very important point. And I like to say now that it's time that we crisis-proof our immunization services to make sure that they are resilient in the face of current and oncoming pandemics and public health emergencies. How do we do that? First, our governments need to increase dedicated financial commitments to immunization services. It is also critical that we increase and intensify investments in our health workforce. We need to support them in being able to deliver essential vaccines to children who need them the most. And lastly, a point I've already raised is that we need to increase demand for vaccines and immunization by building back public trust and confidence in vaccines. Thank you.
Doctor, I can't thank you enough for your time and indeed insights here, although I feel we should have had more time. We're still dealing with countries that hog vaccines when they are in dire need the world over. But that's a conversation for another day. Dr. Edina Amponsah-Dacosta, a postdoctoral research fellow at the Department of Health Sciences in the University of Cape Town.